Hi there. Welcome to Dream City Clinic. Are you here for the cranial nerve examination, but eyes closed? That's for you? Okay. Please get yourself cozy and sit down right in front of me, okay? Just in that medical chair that's right there in front of me. Okay? So, what we're going to do today is give you an eyes closed exam because you said that you've been having difficulty sleeping. Okay. And you know the rules, right? Keep your eyes closed, otherwise we gotta keep repeating this exam visit until you keep your eyes closed. Think you promise? Good. Let's start by closing your eyes now and making sure that your eyes are closed. Let's go. So, eyes closed. Hold them closed for 5, 4, 3, 2, 1. Open your eyes for the last time for this visit. Take a look around. Take a look at your eyes, and now we're going to close them and keep them closed for the duration of this test. We're keeping your eyes closed just to test all the functions of your cranial nerves to make sure that everything is working as it should to help you sleep. Okay? Are you ready to keep your eyes closed now? Close your eyes. And hold your eyes closed for the duration of this test. Okay, great. We're going to perform basic cranial nerve exam tests, but the first test we're going to do is to make sure that your eyes are closed, okay? I'm going to turn the lights off in this office, and what I want you to do is keep your eyes closed. Okay? Keep your eyes closed. And with them closed, we're just going to give you quick tests to make sure that your eyes are for sure closed. Good, relaxed. Eyes closed. Okay, I'm going to put a quick flashlight over your eyelids. You might see a little bit of light. Is that correct? Good. Keep your eyes closed. And do you see the light perhaps moving away from your eyelids? Yes or no? Okay, and what about now? The light may be a little bit closer to your eyelids now. And then what about now? It's a little bit farther away. Another quick test now that your eyes are closed. Are my hands close to you or far away? Eyes closed. Okay, hard to tell. Okay, what about now? Are my hands close or far away from you? Okay, a bit hard to tell. Very good. So, just making sure now, just that your eyes are closed. If your eyes are open, you might look at my hands, but I'm just testing to make sure they're closed. Okay, looks like they're closed, and let's begin with our first test, okay? Our first test is actually going to be one of my favorite. It's the most relaxing. We're going to give you a quick hand test. Now, we'll be able to tell by keeping your eyes closed how many fingers I'm holding up by listening with your ears. Okay, so let me know how many fingers I'm holding up, but you'll be able to tell with your ears if you're paying attention, okay? So if I have 2 fingers up, you might hear, okay? But if I give you the option between 2 and 3, that will be your cue to count. Are you ready? Let's start. How many fingers am I holding up? 3 or 4? 3 or 4? 3 or 4. Eyes closed. Good. Guess in 3, 2, and 1. That's 3. Good job. You got that correctly. It looks like the occipital cranial nerve is working correctly. Once again, how many fingers am I holding up? 4 or 5? 4 or 5? 4 or 5? 4 or 5? Take a guess in 3, 2, 1, eyes closed. Good. That was 4. Let's write that down. You're going to want to open your eyes right now for this last 2 set because they are going to get a bit more difficult. Let's go. Okay. 5 or 1. 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 Take a guess. In 3, 2, 1. Good. It was 1. A bit more difficult because I made the sound a little bit faster, but keep your eyes closed. Are you ready for the last 2 of the numbers test? Okay, take a guess. 5 or 1. 5 or 1. 5 or 1. You're gonna want to open your eyes for this one, but keep them closed and think. 5 or 1. 5. Use your ears or 1. Good. Take a guess. If it's 5 or 1 in 3, 2, and 1. Good job. That one was 5. We introduced a more difficult pattern, but we slowed the sounds down so that you'd be able to identify the 1. Okay, and this one will be the most difficult one. You're going to try to keep your eyes open, but please keep them closed so we can affirm the tests of your amazing medical procedure today. Okay, good. So we're going to do 3 or 1. Are you ready? 3 or 1. Let's go. 3 or 1. 3 or 1. 3 or 1. 3 or 1. Very good. Let me know. In 3, 2, 1. God, that one was 3. Very good. I'm writing that down. Okay. That was your proximity and sound test. We're going to move on to a light test, and this one is my favorite because you're going to want to open your eyes the entire time, but I'm going to ask you to keep them closed, okay? Eyes closed for this part of the cranial nerve exam. We're going to test your reflexes with your pupils, but with your eyes closed, okay? So, I first have a pen light right here, okay? And the pen light is currently over your eyelids. What I'm going to ask you to do is I'm going to get extremely close to your eyes. And if this is a repeat exam because you opened your eyes once, because I do see your eyes taking a look right there, it's very close to your screen. So if you're watching with your screen, put it a little bit closer to your face until you're able to see the flashing of the eye flashlight over your eyelids. Great. And right now the flashlight is currently over your eyelids. All you have to do is let me know when you no longer see the light over your eyelids. Are you ready? This one you're going to want to open your eyes the entire time, but I ask you to try your best to keep your eyes closed, and I'll watch to make sure that your eyes are closed. Eyes closed, let me know when the light is no longer on top of your eyelids. Let's go. Let me know when. Good. Let me know when. Now, very good. Good job. And again, let me know when you can no longer see the light. Let's go. Good job. So you were able to identify when the light moved away from your eyelids. Good job. Okay, this a bit more difficult now by flipping it. So let me know when you see the light pass over your eyelids. So we're going to move the light closer and closer to your eyelids to be right on top of your eyelids so you can see, but keep your eyes closed. And let me know the moment when you can see the light partially pass over your eyelids, okay? Don't open your eyes. I saw that you almost did right there, okay? So keep your eyes closed. Let's begin. Let me know when you see the light. Good. Good. Great. Eyes closed. I see your eyes. Good. Great. Eyes closed. Good. Good. Eyes closed. Good. Good. Eyes closed. Great. And now, very good. Do you see the flashlight over your eyelids? Yes or no? Let me know in 3, 2, and 1. Very good. You did great. And one more time. Are you ready? Let me know when you see the flashlight over your eyelids. Eyes closed. Let's go. Very good. Very good. Keep your eyes closed. Very good. Eyes closed. Very good. Eyes closed. And do you see the light right now over your eyelids? Yes or no? Very good. You do. Very good. What about now? Yes or no? Let me know in 3, 2, 1. No, you don't. Very good. Eyes closed. Last time. Do you see the light now pass over your eyelids? Let me know in 3, 2, and 1. You don't. Very good. Okay. So it appears that you passed that with flying colors. That was amazing. Good job. Okay, we're gonna move on now to one of my favorite tests. This is called a olfactory sensory nerve test. You gotta keep your eyes closed for this because you're gonna want to open your eyes, as you might not be able to identify some of the fragrances that we have here. But what this is I have several essential oils, and the label is on them, so I ask you to keep your eyes closed for this part. But we're gonna open the bottles and I'll have you smell the essential oil, and you let me know what you think it could possibly be. But if you open your eyes, it will give it away. So this is the most difficult part of the test in my opinion. So you take a guess. What is that essential oil? I will also give you hints. Okay, very good. Let's begin. I'm going to start with this one first, as it is a little bit easier, but eyes closed. Let's begin. Here's the first one. It's in front of your eyes. So, eyes closed. I saw that you tried to take a look. I'm going to place this under your nose now. Breathe in. Breathe out. What could this fragrance be? Breathe in and breathe out. That one, it reminds you of, very good, citrus. Okay, fruit. Yes, indeed. Perhaps a little bit like summertime. Any guesses? Take a guess in 3, 2, 1. Very good. The first one is orange. You almost got that one right away. If you did, let me know. Okay, let's get on to the second essential oil. Keep your eyes closed. This one smells fantastic. Eyes closed and breathe in and breathe out. What is that one? Breathe in. Breathe out. That one is very good. A very minty, cooling refreshing one. I think you got this one. Take a guess in 3, 2, 1. Very good. That one was mint or peppermint would be correct. You didn't even need to open your eyes to take a look because this one is the best in my opinion. On to the next one. Eyes closed. It's going to get a bit more difficult from here on out, so try your best. I love this next one though. So here's the next one. Eyes closed. Don't open your eyes. Keep them closed. Very good. And use your sense of smell. Breathe in. And breathe out. Breathe in. And breathe out. What could this one be? Yes, this one is floral. It's often used in teas, which you may have gotten. It's also a bit sleepy. In fact, it's often used in, I would even like to call it spas, because they use it frequently for spa settings. Any guesses? It is a flower. Take a guess in 3, 2, 1. Eyes closed. Good. This one was lavender. Did you get that correct? Any answer like floral would have been correct too, which I think you got. So good job. Let me write that down. Are you ready for 3 more? I think you're doing great. The next one is a bit more difficult, but I think you'll get it. Eyes closed. You're going to want to try to open your eyes as these get a bit more difficult, but try to keep them closed. This one's amazing. This one is a bit more difficult, so try your best. Eyes closed. I saw that. Breathe in. And breathe out. What's that one? Breathe in. And breathe out. Eyes closed. Any guesses? This one is a floral. It's often used in teas. It is a flower, and people use it frequently for tea beverages and sometimes for desserts and pastries. Okay. And people say that when you make this into a tea, it calms you down. Any guesses? It is a flower. Take a guess. Breathe in and breathe out. In 3, 2, 1. Very good. This one was chamomile. Chamomile. If you got floral though, that's exactly what we're looking for because this one smells amazing. It smells exactly like tea. Okay, this next one you're going to try to open your eyes again, but try to resist the urge to. And the last one will be the most difficult, so there's 2 left. So, here's the next one. Eyes closed. Okay, yes, this one, very strong. It reminds me of perfume. Eyes closed. Breathe in. And breathe out. Eyes closed. Any guesses? This one is one of the most difficult ones to identify, but we're only looking for one key feature. Any guesses? Yes, it smells like, very good. It actually smells exactly like, in my opinion, like laundry detergent. And it also kind of smells like if you went into the forest and you were right by a waterfall. That is exactly what this smells like. It is a plant, and it is often used as an essential oil. Any guesses? Very difficult. Take a guess in 3, 2, 1. Very good. This one is called vetiver. It's often used in perfumes, but what we were looking for was plant and outdoors, so you did great. Okay, and you gotta promise me you're gonna keep your eyes closed for the last one, because it is the most difficult. Are you ready? You do seem to get a bit more tired as we've gone along through this exam, would you agree? I can tell. Okay, last one, eyes closed. You're gonna want to try to open your eyes, but that's okay. Eyes closed. the last one is the most difficult, but it will be the last one, so keep your eyes closed and try not to take a look. Here it is. Breathe in and breathe out. You can identify that it is the most difficult, right? Yes. Any guesses? This one smells exactly like a tree. It actually also smells exactly like if you were at a bonfire with your friends and there was marshmallows. Indeed, that's exactly what it smells like. And it also smells like the outdoors, but more of a earthy and tree-like smell. Any guesses? 3, 2, 1. Keep your eyes closed. This last one is sandalwood. And sandalwood smells like a beautiful tree that's made with some sort of candy. It smells amazing. You did great. For this next test, I have 2 types of candy, and they're 2 different flavors. I'll show you. One of them is strawberry, and the other one is blueberry. And I'm just going to ask you to just try one of the candies at random, and you tell me what flavor I chose, either strawberry or blueberry. Again, it will be obvious if you open your eyes, so keep your eyes closed, and again, take a guess, strawberry or blueberry. Let's try. I'm going to shuffle between the 2. Okay, eyes closed. And what candy did I choose? Strawberry or blueberry? Okay, say ah. And what was that? Strawberry or blueberry? Take a guess in 3, 2, 1. Very good. That one was blueberry. Amazing. And now I'm going to choose between the 2 again. Either I will choose the same one or a different one, but keep your eyes closed and take a guess. We're first going to shuffle them one more time. Eyes closed. Okay. Eyes closed. I chose one. Strawberry or blueberry for this candy. Say ah. And try it out. So which one was it? Was it strawberry or blueberry? Eyes closed. Take a guess in 3, 2, 1. It was strawberry. Good job. Okay. And we have one last test here today before we let you go for the cranial nerve exam. Eyes closed. I have 3 items here. You're going to want to open your eyes. It's the most difficult test. But using only your ears alone, let me know what sound you hear. Okay? There's going to be an item for each of these sounds. Just take a guess at what is making the sound. So I need your full attention to this. Eyes closed. Are you ready? What is making the sound? Eyes closed, otherwise it will be obvious, okay? And let's start. What's making the sound? Here's object 1. Okay, any guesses? Eyes closed. I saw your eyes. Take a look. Eyes closed. And once more, pay close attention. And what is this item? Eyes closed. Take a guess. In 3, 2, and 1. Good. Did you guess it was scissors? Then you would be correct. Are you ready for round 2? You did great. Let me know, what is that sound and what's making that sound? Listen carefully. Are you ready? Let's begin. This is item 2. Keep your eyes closed, otherwise it will be obvious. Let's start. Listen carefully. And what's that sound? Any guesses? Let me know. In 3, 2, and 1. What is that item? Eyes closed. I saw you try to take a look again. This one is a hairbrush. Okay, did you get that one correct? Yes or no? Let me know. Okay, and on to the last one. This might be the most difficult, or for some it might be the easiest one to identify. Are you ready? Eyes closed, because it will be obvious. What sound is this, and what is it coming from? Let's begin. Any guess what it could be? Take a guess. Listen carefully. Keep your eyes closed. Otherwise it will be obvious. So eyes closed. I saw you again try to look. Eyes closed. So what is that? Let me know in 3, 2, and 1. If you guessed glasses, you would be correct. Now, how many out of the 3 did you get correct? Let me know in the comments below. And how did you perform during this exam in your own opinion? I would also love to hear. Okay, so we're going to ask that you keep your eyes closed for the rest of this cranial nerve exam. And we're going to remake the test in the morning time and see how long it actually takes you to go to sleep when we redo the exam, and find out which parts you thought were the best, and find out also which parts you thought you wanted to open your eyes on more so that we can adapt for the next time to help you sleep, okay? So we're just going to turn the lights off here now. We're going to write some notes until you fall asleep, okay? Thank you so much for coming to Dream City Clinic to have the cranial nerve exam today. Again, I'm Dr. Brain. Pleasure to meet you. And I will be seeing you in the morning to retest with your eyes closed. Thanks so much for coming on by. Okay, I'm going to finish up your results now with a couple of notes, but remember, keep your eyes closed.